Did you know that your gut health could be the key to understanding and alleviating your chronic pain? Stay tuned. In this video, we're going to be talking about several gut conditions that will help you understand what might be contributing to your chronic pain. Let's start talking about three different types of bowel problems. First, you have IBS, which is irritable bowel syndrome. This is characterized by a series of symptoms like bloating, abdominal pain, bowel changes like diarrhea and constipation, and fatigue. The second one is IBD, or inflammatory bowel disease. This is where you have chronic inflammation of the intestinal tract, whether it be in Crohn's or in ulcerative colitis. This can be a much more serious condition and can lead to further complications. The last one is leaky gut syndrome, which is still controversial, but this is a situation where the lining of the gut becomes more permeable or open, allowing toxins and other harmful things to get across the membrane into the bloodstream. Statistics show that 10 to 15% of the population is affected by irritable bowel syndrome. And another 3 million Americans are diagnosed with inflammatory bowel disease every year. Where's this connection? The connection is through the gut-brain axis. This is a two-way highway of communication between the brain and the gut. Signals from the gut will influence the brain, and signals from the brain will influence the gut. When you have inflammation and irritability in the gut, this will increase your perception of pain in the brain. It can affect the amygdala, creating more anxiety, and it can also increase your irritability throughout your whole body, thus increasing any type of chronic pain, especially in the joints and also in the skin. A recent paper published in 2023 in Biomedicines showed the connection between fibromyalgia and irritable bowel syndrome. And they also showed a role of manipulating the microbiome that showed an improvement in both the irritable bowel syndrome and also the fibromyalgia. So there are connections between the gut and the fibromyalgia and other pain syndromes. So this is just one example. Other conditions such as eczema and psoriasis have been shown to have a connection with the gut microbiome as well. Cleaning up the gut has been shown to help with those kind of conditions. I've done more extensive videos on the connection between the brain and the gut-brain axis in anxiety, depression, and brain fog. So check those videos out. So what kind of conditions have you been suffering from? Post those below so that we can talk in the comments there. How can you improve your inflammatory bowel disease, leaky gut, and irritable bowel syndrome? Well, the first thing you need to do is look at diet. You want to look at fiber. You want to look at green vegetables. You want to look at healthy fruits like your berries. And you want to eliminate processed foods as much as possible. Consuming prebiotic foods like sauerkraut, fermented foods, kefir, kombucha, and others are also helpful in feeding the microbiome so that you can have more balance and improve the leaky gut and decrease the inflammation. Since poor stress management is part of the problem with all three of these conditions, stress management is important for you to be able to recover from this or to improve these conditions. So looking at things like mindfulness, yoga, exercise, breathing techniques, saunas, these are all going to be helpful in helping to modulate your stress. Also things like adaptogens, like ashwagandha, phosphatidylserine, ginseng, and others. These will help to buffer the cortisol and calm the nervous system down. Another modification that must be done is you have to look at what is creating the toxicity in the gut. If there are microbes like Lyme and co-infections or mold or parasites that are releasing toxins, whether they be endotoxins or heavy metals, or if you are ingesting a lot of these from your diet, from the air, from the water you're drinking, those things need to be corrected if you're going to calm the inflammation down. Lastly, as far as supplements go, things like the probiotics are really good. There are certain ones that actually help to lower histamine, like Akkermansia, Bifidobacterium. There are prebiotic fibers that you can take. Designs for Health has a good one that I use called paleo fiber, but you can also have other types of fibers that will help to give balance to the gut. And then Saccharomyces boulardii is another one that will help to reduce some of the inflammation as well. Finally, if you have seen improvement in your chronic pain when you've made dietary changes like this, share your story in the comments for others to be able to see. The best help is somebody else's story often. There are people out there that are struggling and that need your help. So I appreciate you putting your comments below. And also, if you'd like to know more about what we can do, you can check out my website, functionalhealthtn.com, and you can also look at my recent blog that goes into more detail about all this.